Well, following one of the largest outbreaks of tuberculosis in U.S. history in Kansas, Donovan, Andrew, and Buchanan counties, professionals have some insight into the outbreak and what people can do to stay safe. KQ2's Noel Harden has more from the county health departments.
Tuberculosis is an uncommon bacterial disease that typically isn't cause for alarm, but a recent outbreak in Kansas and Missouri has some people concerned. There are currently 67 active cases in Johnson and Wyandotte County in Kansas, but 35 of those have been treated and are considered no longer active.
TB is a respiratory transmissible, so it's transmitted through the air. It is a bacteria that typically enters someone's lungs and infects them in that manner. So you could get TB from simply just talking to someone, through singing, through coughing. It's airborne.
While TB has similar symptoms to the common cold, flu, or other illness, it can be identified through some key symptoms such as a lasting cough that can be bloody, chest pains, or anything else out of the ordinary that doesn't seem to go away.
The infection can live in the air for hours. The symptoms that people want to look for is a cough lasting longer than 3 weeks, fever, night sweats, unexplained weight loss, chest pains. Any of those symptoms that aren't going away, aren't getting better with normal over-the-counter medicines, they can go see a provider.
While the Donovan County Health Department hasn't seen any tuberculosis cases in their vicinity yet, they're still preparing for any possible cases.
We have not had any active TB cases in our county in over 20 years. We have had latent cases that have just been isolated incidences, but not for several years in our county. However, this is something that KDHE has protocols for and keeps us updated about at all times, so that way we know what to do if it does become a threat or a problem.
Noel Harden, KQ2 News.
The departments also want to emphasize that while the outbreak is the largest they've had in a long time, people should not panic. Currently, there is not a widely used vaccine to use against TB. If you think you might have TB, talk to your doctor about getting tested.